When Professor Mohammed Nasir Sambo was appointed into office, he was given a 10-point presidential mandate. On that list was the attainment of universal health coverage. The determination saw to the introduction of a program named Group Individual Family Social Health Insurance Program, popularly called GIFSHIP. This program serves as a window to plug in a larger part of the society, that is, the informal sector, so that they too can have access to affordable health care. In this episode, we'll bring you an interview with Dr Eke Jonathan, DM Formal Sector, where he speaks on GIFSHIP Program and how far the program has come since 2021. Welcome to Easy Access to Healthcare for All, a program that brings you updates on the activities and happenings around the National Health Insurance Authority and the health insurance space at large. My name is Aisha Mohammed Ahmed, your anchor. I will be back shortly with details about GIFSHIP as well as news around the NHIA. Keep watching.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
Welcome back. Easy Access to Healthcare for All kicks off with a news segment. In our lineup, NHIA sensitizes stakeholders on medicine supply initiative in Enugu. These and more stories coming your way shortly.
The NHIA recently held a one-day sensitization program on the Medicine Supply Initiative. This was in Enugu, which is one of the pilot states for the pilot phase of the program. The event brought in different stakeholders in the health sector across the zone. Dr. Ibere of the Standards and Quality Assurance Department of the NHIA gave an overview of the Medicine Supply Initiative.
To ensure the availability, we spoke about stock. So we want to be sure that drugs are available within the system for people to access. Then the costs by the initiative, by the Medicine Supply Initiative, the intention is to drive down the cost of medicines within the system.
The event gave stakeholders the opportunity to seek clarifications on different aspects of the initiative. They also shared their thoughts on the initiative.
Like they rightly said today, that drug stockout is a major problem. We also have experienced it as we started introducing our state health insurance scheme. So in that sense, this program is a very welcome program because we understand that it is aimed at addressing that drug stockout syndrome. So it is welcome.
The issue of drug management agency and every other thing, I believe that if it is well implemented, it will help both the patient, the health caregiver, and even the ministry at large.
Staff of the National Health Insurance Authority have taken the health insurance campaign to the doorstep of traditional institutions. The Sokoto State Office of the NHIA visited the Palace of the Sultan of Sokoto on a sensitization exercise, where it met with members of the council as well as district heads in the state. Led by the state's coordinator of the NHIA, the team made presentations on health insurance and the various programs of the NHIA, particularly the Basic Healthcare Provision Fund. After the presentation, the Sultan of Sokoto directed the chairman, Sokoto State Zakat and Endowment Commission, to liaise with the NHIA Sokoto State team with a view to seeing how the commission can enroll vulnerable people across the 23 local government areas in the state. The chairman of the Sokoto State Zakat and Endowment Commission on his part said collaboration with NHIA is a welcome development. Consequently, he also suggested the Council's Committee on Health to work out modalities on how staff of the Commission and their relations can enroll into the GIFSHIP program on individual and family basis. At the end, questions were asked and answers provided.
Welcome back. The program is easy access to healthcare for all. The GIFSHIP program is the flagship program of the National Health Insurance Authority, designed to enhance coverage. The program gives room for persons outside the formal sector to enjoy health insurance, thereby increasing access to healthcare for the majority of Nigerians. In our next segment, Issues Around the NHIA, we shall bring you insight on GIFSHIP and how far it has come since 2020 when it was launched. Please stay tuned.
The GIFSHIP program is a flagship of the National Health Insurance Authority. It was formally launched on the 26th of November 2020 by the Minister of Health, Dr Eke Jonathan. The major objective of the program is to rapidly expand the scope of healthcare coverage in the urgent quest by the Nigerian government to attain universal health coverage.
It is supposed to be an all-encompassing program that will cover G group of people, I individual, and F family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed.
To be more specific, GIFSHIP is open to small-scale enterprise with less than 10 staff, non-cohesive groups of persons such as associations, unions, and institutions outside the organized private sector (OPS), self-employed individuals, families and groups, retirees and retiree associations, diaspora groups, foreigners living in Nigeria, adopted persons such as those paid for by members of the National Assembly and philanthropists.
One of the appealing features of this program is, I know you are a rich man, and I know that you are a philanthropist, and I know that people have been disturbing you to pay for their healthcare services. Some will come and say, give me, my wife is going to deliver. They say it's operation and I don't have money. So this platform, it will help you as a rich and philanthropist man to come and say, okay, who are the people that are within my 5 view? I will get them all together. If they are 20, if they are 30, if they are 100, you register them under your own umbrella. So you have become a group.
In order to register for GIFSHIP, the contribution rates are 45,000 Naira per annum for individual subscriber. The subscriber may add 2 direct dependents. A family will contribute 60,000 for 4 biologically related persons. Each extra dependent of a family will be enrolled at 15,000 Naira. 10 persons shall be the minimum number of persons in a group, except small-scale enterprises with less than 10 employees. Group enrollment is at a contribution rate of 15,000 Naira per person per annum. These rates are subject to changes as may be determined from time to time by the NHIA. Since its launch nearly 2 years ago, how has GIFSHIP fared in terms of coverage? Dr Eke Jonathan, General Manager, Formal Sector of the NHIA, gives an update.
The GIFSHIP program is doing well generally. Most of the states have, in fact, our state coordinators have taken it upon themselves. That is the driving force of a lot of their actions now. Like, but if you look at Kwara State, they are doing very, very well. You look at states, especially in the southwestern states, they are doing, the southeastern states, they are doing very, very well with the GIFSHIP. Even some of the northern states are equally coming up to pick up the coverage with GIFSHIP.
Dr. Eke Jonathan says its acceptance cuts across individuals to groups and organizations.
And when you talk about GIFSHIP, as you know, we have GIFSHIP in 4 variants of GIFSHIPs. So we have the GIFSHIP, what we call the general, whereby people make contribution. We have the GIFSHIP retirees. That we have about 40-something thousand retirees under that GIFSHIP, especially the police retirees. We have police retirees, the DSS retirees, they are under that. We have the GIFSHIP, the one we say for the NYSC. That What we have in our register is close to 500,000 under that. And then you have the constituency project, where the honorable members in the National Assembly use it to carry out their constituency projects. So we have a substantial number, close to 25,000-30,000 under that.
Every new program comes with its challenges and loopholes, but the NHIA has taken steps to address some of the hurdles so far faced in implementation.
The registration, when we started the program early, we had some challenges with getting into the system because, the ENHIA system we are trying to put in then, we are working on that, and with time, there's some of the challenges that we faced. We are getting through it. We have to decentralize the enrollment to the states. We are giving them tools to ensure that whoever comes in was registered. We are even going about building their capacities to see, to address some of the challenges that we had noted earlier when we started the program implementation.
When GIFSHIP was created, the NHIS was just a scheme. With the new act signed into law, one wonders its impact on the GIFSHIP program.
The NHIA Act, where we're talking about decentralization, you look at the issue of GIFSHIP at various levels. You have the GIFSHIP G, that is the one we will say for everybody. Those who can afford to pay, you contribute. In fact, the discussions are already ongoing as per whether the NHIA will hand that one over to the states. Because actually the states asked, why is NHIS then implementing GIFSHIP? But one thing was clear, that the state health insurance systems, a lot of them were not ready. So there was no way we could deny Nigerians access. But now that this law has come out, and a lot of the state health insurance schemes are getting stronger and stronger, I think these are some of the things that along the line the discussion will go towards that.
Bearing in mind the mandatory nature of the NHIA Act, which will bring in more Nigerians on the program, will there be a review of some operational modalities of the GIFSHIP as it concerns the waiting periods, benefit package, and other operational modalities?
There is no program that will just stay like that. It's work in progress. That's why these things are reformed. For example, we were talking. What led to all those waiting time thing was to check what we call adverse selection. We realized that when we are doing the voluntary contributors program, which transmitted to the GIFSHIP, somebody will come because he needed to have a cesarean section next month, buy the voluntary contributor, next day go for cesarean section, and it was eating deep. But now with the law, the new NHIA law that is talking about mandatory health insurance, when the implementation begins in NX, a lot of these things are going to be reviewed because the condition for universal health coverage, a lot of them have been met. One mandatory means that everybody will come. So the pool will be large enough to crop subsidize. So at that particular time, what will drive what we are going to give will no longer be ability to pay, but now on need.
But what is the experience of GIFSHIP enrollees at the point of accessing care? And what are some of the operational modalities of the program?
You know the way the system is structured. When you are hearing GIFSHIP, you are hearing formal sector, you are hearing, these are just different platforms getting people into the system. But the final pathway, which is the access to service, the same benefit package they access, the same tariff structure, so it's the same thing. The way the NHI is structured, what we do is that these lives are given to the HMOs. So the HMOs are just paying the hospitals, the capitations. Primary hospitals, the capitations. If you are referred, the care is taken. So the experience we have had, most of the hospitals that receive the GIFSHIP patients, they are still doing very, very well with them. I'll give you an instance. Some few weeks ago, we have another GIFSHIP though we put it under GIFSHIP, for the MBA. That we have had some number of lives that are registered on. What we had, one of them called from Benin that he had some little challenge, and by the time we got the HMO, they resolved those issues and they took their treatment, and we're okay with what they got. So by and large, the experience of our enrollees, GIFSHIP enrollees with the healthcare providers it's improving. Let me just use the word is improving, because there is no system where you will not have some challenges, but it's a work in progress, and a lot of these challenges we are working on them gradually to see, with all the reforms that are going in the system, I know it will trickle down to, in terms of patient satisfaction, we'll get that.
How has the experience been for some enrollees who have enrolled into health insurance under GIFSHIP?
My name is Rachel Chinelo-Nweke. I'm a member of the NBA Abakaliki branch and a proud, happy recipient of the NBA National Health Insurance Scheme. I want to thank the leadership of the NBA and the Welfare Committee. Because of this card, I've been able to access medical facilities faster and better and at a very affordable rate, unlike before. Thank you so much for the job you are doing, sir. I really appreciate, and I know that the NBA and everyone who benefited from this scheme will be very glad that you are here for us. Thank you so much, sir.
Welcome back from that break. Easy access to healthcare continues with our stakeholders segment. Today on this segment, we'll bring you an interview with Dr. Musa Haruna Ambintame, who is the Executive Secretary of the Taraba State Health Insurance Agency. Dr. Musa Haruna speaks on persons covered under the State Health Insurance Agency.
We have the formal sector that takes care of workers, and by workers we even mean political appointees, civil servants, and we also have a scheme that takes care of the vulnerable, and the funding from the federal government is called the Basic Healthcare Provision Fund. And what the state governments give us for the vulnerable is called the Equity Fund. Yes. So we use the funds to make sure that people who on their own cannot pay, either because they're physically challenged, or because they're elderly, or pregnant women who are short of funds, children under 5 years of age, we enroll them under either the Basic Healthcare Provision Fund or the Equity Fund. And then we have a special program for university students and students in tertiary institutions. We also have the informal sector that takes care of people who, and you know, by far, the largest population of Nigerians belong to the informal sector.
He sheds more light on the health insurance under one roof initiative of the NHIA.
With the coming on board of the National Health Law and the idea of getting states to implement a form of insurance for citizens of those states came up, and there was the need that Nigerians should move together, because if states run a parallel system and the NHIS runs a parallel system, you want to know the number of Nigerians that are benefiting from health insurance. The figure will continue to remain abysmally low. But with health insurance under one roof, it means what we're doing in Taraba State, what the NHIS is doing, and what some other, or rather the remaining states of the Federation and the FCT are doing, will all add up, and we'll be able to say, oh, Nigeria is on course towards achieving universal health coverage.
States operate on individual laws, but however, they work towards the same goal of universal health coverage. Dr. Musa Haruna speaks further on that.
Every state has its own law, but the laws are in line with guidance we received from the National Health Insurance Scheme. That is to say that the laws are not very different, and this explains why what we're doing will rhyme. They will be like what the other states are doing, and so the laws provide for an agency that will coordinate the execution of health insurance in the various states.
Finally, Dr. Musa says to achieve its goals, the NHIA and state health insurance agencies collaborate in many ways. He explains some of them.
We collaborated a lot because, as I said, the funding for the Basic Healthcare Provision Fund comes from the federal government. It comes to the National Health Insurance Scheme, and then they pass it to us. We meet, and then we are guided on how the funds should be used.
And that was Dr. Musa Haruna Amintame speaking on the operations of state health insurance agencies. We will now take your questions in our last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Question: what is the GIFSHIP program?
It is supposed to be all-encompassing program that will cover G, group of people, I, individual, and F, family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed. Provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
With this, we've come to the end of today's episode of Easy Access to Healthcare for All. Please join us next week, same time and same station, for another interesting package. Do take advantage of the GIFSHIP program to enjoy accessible and affordable healthcare too. Have a good evening.